Dizziness on Wegovy, Semaglutide, or Zepbound, Tirzepatide, is often caused by dehydration, eating less, or lower blood pressure. Low blood sugar is possible, but it is usually more likely when insulin or certain diabetes pills are also involved. The timing, body position, and accompanying symptoms often separate these causes. Sudden severe dizziness needs a different response than brief lightheadedness after standing. Dizziness can describe three different problems. Lightheadedness feels like you may faint. Vertigo feels like the room is spinning. Imbalance feels like your feet cannot track straight. One word for all three makes the cause harder to identify. For lightheadedness, these drugs can reduce intake by lowering appetite and slowing how quickly food leaves the stomach. You may drink less because meals no longer remind you. Nausea, vomiting, or diarrhea can remove more fluid. With less blood circulating, standing can briefly reduce blood flow to the brain. That feels like dim vision, weakness, or near fainting. Trials found more dizziness during treatment without identifying the cause. With Wegovy, dizziness occurred in 8% versus 4%, with a placebo containing no active medicine. Reports doubled, although most users still did not experience it. Zepbound trials showed roughly 4% to 5% versus 2% with placebo. That was also about twice the rate. Fluid loss can cause dark urine, dry mouth, less urination, thirst, or a faster pulse. Vomiting and diarrhea make it clearer. Mild nausea matters because people often drink less without noticing how much intake changed. Position matters because dehydration often becomes obvious when you stand. It may appear when you rise from bed, leave a hot shower, or stand after sitting. Heat and alcohol widen blood vessels. Exercise adds fluid loss. Together, those changes can leave too little fluid in your bloodstream when you stand. A spinning sensation usually does not fit simple dehydration. Vertigo often worsens when the head turns or rolls in bed. Ear pressure, hearing changes, or recent viral symptoms add clues. The injection may be blamed because timing overlaps, while the actual problem sits in the inner ear. Low blood sugar usually causes a different pattern rather than a spinning sensation. Shaking, sweating, sudden hunger, blurred vision, irritability, confusion, or a racing heartbeat make it more likely. Dizziness alone is weak evidence. The body releases stress hormones during a low, which creates the sweaty, shaky feeling many people recognize. If you use insulin or certain diabetes pills, listen closely. Sulfonylurias are diabetes pills that push the pancreas to release insulin. Using insulin or a sulfonylurea with these drugs raises the chance of hypoglycemia, meaning blood sugar that falls too low. Severe lows are much more concerning when insulin or sulfonylurias are involved. A glucose reading below 70 milligrams per deciliter is treated as low. This is the usual level for treating a low before symptoms worsen. Take 15 grams of fast-acting sugar, such as glucose tablets or juice. Wait 15 minutes before rechecking, because blood glucose needs time to rise. If swallowing is unsafe, do not give food or drink, and seek emergency help. A normal glucose reading does not make recurring dizziness harmless. Mild morning lightheadedness can mean the dose of a blood pressure medicine is now too strong. Weight loss, smaller meals, less salt, and fluid loss may lower pressure together. A prescription that once controlled high blood pressure may now push it too far. That mismatch is easy to miss. A seated office reading can look acceptable, while pressure drops after standing. The person keeps drinking more water, yet dizziness returns every morning. Fluid was only part of the problem. The cause becomes clearer when dizziness appears with a blood pressure drop after standing. Zepbound trials found low blood pressure more often among people taking blood pressure medicines. It occurred in 2.2% of that group versus 1.2% without those medicines. That is nearly double the rate. Diuretics, often called water pills, can increase urine loss and make the blood pressure drop after standing more severe. Dose timing adds another clue. Symptoms that begin after a dose increase may reflect stronger appetite suppression, more nausea, or lower intake. Dizziness matters when it interferes with walking, driving, bathing, work, or getting safely to the bathroom at night. Not every dizziness pattern points to the drug or its companion medicines. Anemia, meaning too few healthy red blood cells, can cause fatigue and lightheadedness. An irregular heartbeat can create sudden weakness or near fainting. Infection, bleeding, or a newly added medication may also start during treatment. When these causes fit, a blood count, heart rhythm check, or infection evaluation may be needed. Some patterns need emergency care, including fainting, chest pain, one-sided weakness, trouble speaking, or a sudden severe headache. Persistent vomiting with very little urine also needs prompt care because severe dehydration can injure the kidneys. Outside those emergencies, recurring dizziness should be separated by trigger, not by intensity alone. Note whether it follows standing, missed meals, vomiting, diarrhea, exercise, heat, or a recent dose increase. If no trigger fits, unexplained fatigue, palpitations, fever, bleeding, or near fainting should prompt a broader medical evaluation. For suspected pressure drops, rest before measuring blood pressure, check it while seated or lying down, then stand carefully. Measure it again after 1 minute and again after 3 minutes. Stop if you feel close to fainting. If pressure repeatedly falls when symptoms appear, that pattern points more strongly to a pressure problem than one later reading. For suspected low glucose, measure during symptoms whenever possible. Record the number, last meal, exercise, injection timing, and diabetes medicines taken that day. One normal reading does not rule out a low during a different episode. Repeated readings show whether dizziness tracks with glucose or another trigger. For suspected dehydration, compare intake with losses. Ask whether drinking fell while nausea, vomiting, diarrhea, heat, or exercise increased losses. Dark urine supports the pattern. Very little urine is more concerning when vomiting or diarrhea continues. When the pattern points to fluid loss, small frequent sips are easier when nausea is present. An oral rehydration drink is made to replace water and salts after vomiting or diarrhea. People with heart failure or kidney disease may have fluid limits. The goal is steady correction, not forcing a huge amount at once. Food matters when intake has collapsed. A small meal with protein, carbohydrate, and some salt may improve stability. Large, greasy meals can worsen nausea. The goal is not forcing a full plate. It is preventing long gaps with almost no fluid or usable energy. Food and fluids cannot correct a medicine dose that has become too strong. Do not independently change insulin, sulfonylureas, blood pressure medicines, or water pills. Bring your measurements and symptom pattern to the prescriber. Ask whether current doses still match your lower intake, lower weight, and new pressure or glucose pattern. Contact the prescriber when dizziness lasts several days, returns after every injection, or follows each dose increase. A slower dose increase may help when dizziness follows each increase. Repeated low glucose readings require prompt review of insulin or sulfonylurea doses. Most dizziness on Wegovy or Zepbound becomes clearer when you stop treating it as one symptom. Lightheadedness after standing may come from fluid loss, lower blood pressure, or a blood pressure medicine dose that is now too strong. Shaking and sweating suggest low glucose. Spinning suggests another cause, so match the response to the pattern, measurements, and warning signs. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.